If you're listening right now, this conversation could save a life, maybe yours or someone you love. Now, World Cancer Day is happening on the 4th of February 2026 with the theme United by Unique. Every experience with cancer is unique, and it will take all of us united to create a world where we look beyond the disease and see the person before the patient. In the studio, I have Dr. Daniel Okereke, who is a resident doctor in clinical oncology and radiotherapy at the Lagos University Teaching Hospital, to give us basic information on cancer. Dr. Daniel, welcome to our studio today.
Thank you, Chinwenduodimgbe, for having me on your studio.
Tell us, what exactly is cancer in very simple terms, and how does it start in the body?
Cancer, in very simple terms, does mean a group of disease caused by normal body cells not following instructions. What do I mean by not following instructions? Every human body is made up of cells. When we did biology, for those who are in science, they say cell is the basic and functional unit of life. The human body system has this beginning from cell. So it is those cells that come together to form your tissues, your organ, your eyes. So the tiniest things. So those little things has a way that God has made the human body that if you want to misbehave, you're supposed to die on a natural death. If you need to grow. But when those cells begin to disobey instruction by nature, they begin to grow into cancer cells.
I know that there is something called malignant cells and benign cells. What is that difference?
If you say you have a cell that is growing, not following instruction, now some become so dangerous that they grow excessively and cause harm to the body. Those ones are malignant cells. Now, the ones that grow, that doesn't follow instruction, but doesn't cause harm to the body, those ones are benign cells.
Now, let's come down to the myths associated with cancer.
Cancer, especially for those that are in a developing country like ours, and then religious in nature, like pious. So most of the time, the first myth that is always there is a spiritual, like it's a spiritual problem. Like maybe somebody is being cursed or somebody is being punished for their suffering. The other myth is that cancer is contagious. Once you have somebody that has it, everybody in that place. And that is why there is a lot of people discriminate them, people
stigmatization.
They think it's contagious. So it is not contagious. It is not a spiritual problem. Some also believe that you take some treatment, they did some surgeries for you before, and that is why you are having it, or took some sugar or something, you start having it. You get me?
Yeah.
And then another myth is that for a country that is underdeveloped like ours, where we have a lot of herbal concussion, people don't really go to hospitals, so they just believe that yes, better to use traditional way, like maybe using herbal remedies, making all these traditional healers and the rest. Those things doesn't cure cancer. And then that your family doesn't have history of family cancer doesn't mean it can never happen. I just told you that cancer is when the cells all of a sudden stop obeying instruction and start growing excessively. So it can happen. And that thing, stop obeying instruction, can happen to anybody, which is called mutation.
What causes the cells to start misbehaving?
Wonderful. So what causes these cells to start misbehaving will lead to what we call the risk factors. What are these risk factors that can happen to somebody that will just all of a sudden the cells start misbehaving? Let's take, for example, people who like smoking. So the body system is not due to taking too much. So those excessive smokers, people that drink a lot of alcohol, people who are into a lot of chronic stress, because the body is trying to imagine a normal computer system that you are operating for 24 hours. What will happen to the system? The system will run very hot, right? So imagine you are working all through, you didn't have time to rest. What will happen? Your body will start breaking down and some of your cells will start misbehaving. So when people don't obey nature, the law of nature, they can start that process. They can initiate the process. And also when people start living gentle lifestyle, like all these people that don't like going anywhere, you just want to sit and cook potato, just be watching Netflix and chill, don't do anything. They don't want to go anywhere around, nothing. They just want to stay one place.
Yeah.
Now, there's another study that shows that birth control pills for younger ladies, not certain age, trying to not give birth, taking a lot of birth control pills, it has also been shown that they can be a risk factor. So in anything you are doing, don't do it in excessive.
Because I've heard stories where someone said they were not taking alcohols, they were not smoking, they were not doing the things that would be termed, they were not taking in the things that were carcinogens, but they got cancer. And I zoned in on what you said about chronic stress, because people work on and on. We have a hustle culture here in Nigeria. And if you don't rest, your body can break down. That is really insightful. Now, what are the most common cancers affecting women, especially in Nigeria?
The first on the list is breast cancer, obviously. In thousands of breast cancer alone takes almost 55%. To tell you how. So followed by cervical cancer. What is cervical cancer? We already know what breast is. Cervical means the mouth of the womb. We in Mexico call it uterus. People outside, they say your womb. So the mouth of the womb where babies come out. So that mouth sometimes can have some changes that doesn't fully instruction into cervical cancer. That is the second most commonest, and which is almost like 10% to 15%. And then the third is ovarian cancer. There is another cancer coming in line, like almost at the same percentage with ovarian cancer, which is colorectal cancer. And the reason is because of ignorance. Colorectal, in anything that has to do with your GIC, like the things you eat and the rest. So the colon, the rectum, all those your intestine go down, and the small intestine, large intestine. The large intestine is the colon and the rectum. So most of the time they lead to changes, especially for elderly women, or especially for people who take a lot of things they are not supposed to take. You know, like our fathers, our forefathers that eat a lot of nature. So those things are not rising up now. There is something I forgot to say. Part of the risk factor, there is this habit that is very common among young people, especially for those who live in developed cities. You notice that when you buy food, they put it in maybe plastic or foil, all this foil, plastic something. There is studies that when you eat food that is microwave inside those foils, there has to be potential risk for cancer. If you want to really warm your food, don't put into those foils. You know, they went to birthday, they went to wedding, they give them food in that foil, they will come microwave inside that foil like that. No, those plastic, something you will mix, the chemical they use to make those plastic, you mix with the food, and there's been a study that yes, it's necessary for cancer development.
Okay, let's move on quickly. What early warning signs should never be ignored by a woman?
For a woman, we actually need to focus on the most commonest, let's say like breast cancer. First, once you start feeling maybe maybe you're trying to take your break, you first something in your breast, quickly, don't waste any time. Don't feel anything that looks like a lump or add something or anything. That is not the normal texture of your breast. Please voice out immediately. And then, if you notice that when you look at your blood, okay, you might not know if your blood is low, but when you are feeling so weak and tired, fatigued, it's probably you're having anemia. Anemia means low blood level. So these are also signs. And then if you start losing weight uncontrollably, then you are eating all this now, then you are just losing weight, and then you need to do something about it as soon as possible. And then maybe you start having pain, especially for breast cancer, having pain in your breast, or you're having discharge, or there is a change in your breast spectrum. Please, voice out to me.
Is cancer preventable?
Wonderful. It's very, very preventable. And that is most of the time, this cancer awareness and Cancer Day on the 4th of February, the main reason is for cancer awareness. The reason why people, maybe because of the need. Let's give an example. Most of the time we think it's a spiritual problem. So if you don't take it serious, or the fear, if they go for training and rest now, most people think so. Once people are aware, and then they do a lot of screening. Now, when you say do a screening, that doesn't mean you have cancer. You are just trying to check your body. You are evaluating yourself to check, do I have this thing? I don't have. And it's good to do screening. Now, what are the major screening you need to do for a woman, especially for breast cancer? The first on the list is self-breast examination. What do I call it?
Self-breast evaluation.
Breast examination. Thank you. You will notice that a lot of women, one of the things I believe the Cancer Society of Nigeria will focus on is teaching women self-breast examination, especially on the 10th day of their menses. The 10th day of their menses, it's expected that every woman, every productive woman should do a self-breast examination. Maybe when they come for those awareness, there will be a physical trainer who will show them how to do it. Using your right hand, you examine the left breast, and using your left hand, you examine the what? The right breast. And you do that when you are taking your shower, especially on the 10th day of your last menstrual period. Sorry, 10th day of your menses. So anybody that is hearing my voice now, this is the giveaway for you. They are getting a free of charge via Invicta. So on the 10th day of your menses, do a self-breast examination. If you want to know how to do a self-breast examination, you can just go on YouTube, type in self-breast examination, and you see that yes, you see how maybe one of those instructors on YouTube will show you how to do it. And then other screening modalities, because of something like cervical cancer, you need to do what is called human papillomavirus training, HPV. They call it smear. You go to your hospital, they take a sample of that place and smear it, if you have any form of cancer. Now, for women, self-breast examination is first. You have to go for the second one. Let's say you do a self-breast examination and you are feeling like, this is not my normal texture of breast. So you go for a clinical examination. So that means you don't need a doctor first to screen yourself. All the people that are complaining, I don't have money. So you now go into clinical. When you feel like, I don't really understand if this is okay or you are not sure, then you go for a clinical examination. That is when you need an oncologist. And the oncologist will now examine you. Maybe do a physical examination, check the breast, do the examination you're supposed to do it properly, and then if there is a need, and then it might send you to do an ultrasound scan on the breast. That is for women who are less than 35 years old. So it's an ultrasound scan. So for women that are above 35 years or 40, they do a mammography. So it is from those results, you now know the next step to do.
What I'm hearing you say is, as a woman, paying attention to your body is really important, because that's what will now inform your decision on whether you should go to the hospital or not.
Yes. And I said that especially for breast cancer, which is ubiquitous, you need to, every reproductive woman hearing my voice, every 10 days of your menses, every 10 days. What I mean by every 10 days, if you calculate the first day you saw your menses, so calculate it to the 10th day. On that 10th day, do a self-breast examination on yourself. So let it be like, this is like the awareness now. That means Invicta is constituting their own part, global cancer awareness, using their platform that every business of reproductive stage on the 10th day of their menstrual period, if you do a self-breast examination. It is when you feel like, I'm not sure that if this my breast is the right way, then you now go to see a physician. That's when they will now do those other examinations, do scan, and then do mammography, depending on the age.
So if a woman is afraid of hospitals or screening results, what would you say to her under 30 seconds?
Dearly beloved, health is actually wealth. You need to take your health seriously. One of the things is that if you die and go, people will always replace you. So you need to take yourself as a priority. Do not be afraid. I've just listed that these things are not spiritual problems, and it has a cure. So please, fight. It's always good to fight. Fight. That's what I will have to say. Fight.
So what are the harmful... What are some of the harmful myths and statements people say to cancer patients that we need to stop saying?
I think that is one of the reasons why we have to do a lot of this awareness and inform people about these myths. I believe because of our cultural nature, the myth itself is a major issue. You can debug those myths and re-emphasize it. A lot of people will be more empathic stops in a lot of things. And then one of the things is that, this thing is not contagious. And for most of us, we need to be very emotional and then support financially. The truth is that cancer treatment is expensive. That is just the truth. It's expensive. It's even expensive in developed nations because those drugs, those treatment options are expensive. So financial support, emotional support, empathy, and then do not carry those needs to your head. Carry those needs on your head and say, no, this thing is actually contagious, all those things. So those are the things we need to actually enjoy them.
There is a possibility that there is a woman that has just been diagnosed with cancer that is listening to us right now. As a doctor, what is your message of hope to that person?
If you have been diagnosed with cancer, you're listening to me now, and that is not the end of it. There is hope once there is life. So what I will tell you to do is that you have to fight for your life. Go to see that oncologist now. Do not be afraid of, I don't know what to do, Just go. Take a step of faith, go. And be radical about it. Remember, we said that these cells are cells that doesn't follow instructions. So if you leave it, it becomes worse. The more you are delaying, the more the prognosis or the state of the cancer becomes worse. The earlier you go, the better for us as clinicians and oncologists to take care of your cancer.
Thank you so much, Dr. Daniel Okereke. We have been speaking to Dr. Daniel Okereke, who is a resident doctor in clinical oncology and radiotherapy at the Lagos University Teaching Hospital. He has been helping us create awareness on World Cancer Day. Thank you so much, Dr. Daniel, for doing this.